What should I expect during a neurological evaluation and examination? I'm Dr. Z, I'm known as the brain guy. This is a question I get routinely from patients. Maybe they're dealing with concussions, traumatic brain injuries, strokes, cognitive decline, dizziness, and even other things beyond that, like developmental disorders like ADHD, autism, things like that. But what are we going to do, right, when we really evaluate the brain? Many of my patients come in, they've already had CT scans or MRIs. If you have a concussion, that's pretty much been worthless, right? You get told it's normal, and then there's really no other plan for you. If you have a stroke, it's valuable to know where the strokes happen, make sure you get the right care in the hospital at that point in time, and it lets you know the extent of the damage. But after that, what do? You can't treat someone purely based upon the imaging. And in most dizziness and vertigo cases, the imaging is going to be completely normal as well. Now, it's definitely of value to have that done, specifically if you develop dizziness or vertigo for the first time of your life without a cause, to make sure there's nothing more serious going on. But let's assume all that's been done, and if it hasn't, if you're someone I work with, then guess what? We do dig into the imaging if we feel it's needed to help give us the answers you need. But when we look at this, what should really be done in a neurological examination, and why is it so important? So first, let's talk about what a neurological examination isn't. A neurological examination is not a time where you only sit and talk with a provider. It's not a time where the provider checks a couple reflexes and moves on, and they say, oh, you know what, I saw you walk in, you're talking okay, tap your reflexes, and that's it. That is not a comprehensive neurological examination, and it should never be confused as such. Unfortunately, I hear that a lot where people have said that is what they've had. So what is actually going to happen and should happen in a neurological examination? Well, we should be evaluating your neurology, right? So what is that? Your neurology is your brain, and ultimately your brain controls everything. Once again, it controls everything. So how you walk, how you talk, your mood, your focus, your concentration, your ability to perceive things, that's all controlled by your brain. So some of the best things that we have to evaluate brain function is movement. Now, let's break movement down into really two different categories. We'll say one is just more of what we call gross motor movements. So it can be things looking at how your body functions, right? Like finger taps, alternating, walking in a line, different things like that. It's part of a motor evaluation. Now, we do much more than that, but that's kind of a small little insight. The other part of the motor evaluation are eye movements. So eye movements are actually windows into the health of our brain. Okay, they're immensely valuable information. And if your eyes are not being looked at, then you're not getting a complete evaluation. Now, when I say eyes being looked at, I do not mean going only to an eye doctor and making sure your prescription is okay. That is not a complete evaluation either. We have to look at eye movement, okay? Eye movements. So now what we do is we look at how you do with a variety of tasks, looking at stationary targets, tracking targets at a variety of different speeds, and not only left and right, but up and down. Also looking at your ability to shift your attention to different targets. And with that, we can really map out what's happening throughout the brain. Now you may be saying, well, who cares? Well, whenever people don't and are not able to perform these tasks appropriately, they can have a wide range of symptoms from fatigue, brain fog, dizziness, poor concentration, word finding, memory, depression, anxiety, irritability, and much more. Now you may say that still sounds a bit simple. You're right, it does sound simple. It does sound simple. But that's till you look at books like this, The Neurology of Eye Movement. So in this edition, it's over 700 pages and it's only on eye movements. So yes, eye movements do appear simple, but yet when it's not doing its, the brain can't control it to have the right eye movements, a variety of things can happen. It's just like a computer. It's pretty simple to push a button on the computer, but if inside in the circuitry, when you push the button and it doesn't respond in the way it should, now all of a sudden it becomes much more complex, and most of us don't know how to fix that. We have to go to an expert. And the same thing is true, but you have to have this evaluated. Most patients with concussions, traumatic brain injuries, strokes, dizziness, vertigo do not have a comprehensive eye movement evaluation. Now, to put it in perspective, part of our eye movement testing is done using computerized technology. That's about 30 to 35 minutes. But then we do, beyond that, about another 15 minutes of evaluating. So it's really about a 45-minute evaluation to look at the eyes and to be thorough and to make sure you're capturing what you should be from it. Now, the other part of looking at stuff is you should be looking at balance. So what's happening if you stand with your feet together, eyes open, eyes closed? What happens if you stand on one foot or one foot in front of the other, or you stand on a perturbed surface like a balance pad? Okay. A lot of people think they do good at this, but they don't realize they struggle till you test. So once again, do not think, oh, my balance is good. Test it and make sure. I have so many patients who I'm like, how'd you do? And they're like, wow, I didn't realize I struggled like that. That happens all the time with balance testing. Eye movements, on the other hand, which we talked about, people usually don't actually realize they struggle because your brain's compensating for you, which is important. We don't want your brain compensating because it will eventually break. So once again, what should you see in a neurological evaluation? Looking at a variety of different motor functions, so balance, eye movements, hand movements, feet movements. Also should include sensation, reflexes and things like that. But beyond that, heart rate, blood pressure, and things like that are also signs into what's happening with brain health. So with all this information, we're able to help individuals get answers to many things as to why they still have dizziness, why they're fatigued despite trying thyroid medications or hormones and other things to try to get out of it, how to help with ADHD, depression, dizziness, word finding, and so many other things. So put it in perspective, when someone comes in here and we do a neurological evaluation, it's 1 hour and 45 minutes to be able to get through everything we need to. And in some patients, we even have to take more time than that, where it can be 2 hours, 2 hours and 15 minutes to really get through it. So if you're dealing with any of those things I mentioned at the beginning, once again, concussions, traumatic brain injuries, dizziness, vertigo, stroke, cognitive decline, autism, any of those, and you're having a very brief neurological evaluation, don't expect a good outcome, because only by having the proper evaluation you need is the provider going to be able to dissect things appropriately and help you get to where you want to be. So I hope you found this information useful. If you did, let me know. And if you'd like to work with me, here's how you can contact me.